What if your body has already been trying to warn you about Alzheimer's, and you have been dismissing those warnings every single day as something else entirely? The indicators aren't just hypothetical risks or genetic predispositions for the future. They are present right now, today. Before any brain scan, before any memory test, before any doctor sits you down, the signs may already be showing up somewhere you look at every single morning without ever connecting the dots. Your hands, your face, two places you see every day, two places that most people never think to look. And research across multiple peer-reviewed journals has established that specific visible and physical changes in both can appear years, in some cases many years, before a single memory symptom ever surfaces. Stay with me until the end, because sign number 7 is the one that surprises my patients most. It looks completely harmless. Most people have had it for years and never once thought it could mean anything at all. There are currently 6.9 million Americans aged 65 and older living with Alzheimer's disease, according to the Alzheimer's Association 2024 Facts and Figures report. That number is projected to reach 13.8 million by 2060. But what almost nobody talks about, what the standard 15-minute appointment almost never covers, is that the biological process behind Alzheimer's begins 15 to 20 years before a single memory symptom appears. 15 to 20 years. That is supported by longitudinal biomarker research published in Lancet Neurology and confirmed across multiple long-term cohort studies. Which means if you are watching this video and you are in your 40s, 50s, or 60s, your body may already be somewhere inside that window. And the most dangerous part? Most of the earliest warning signs are not in your memory. They are somewhere far more visible if you know what you are looking at. My name is Dr. Monty Fisher. I have spent over 2 decades working with patients in neurology and cognitive health, and I want to be direct with you about something. I have sat across from too many patients who came to me after a diagnosis had already been made. Patients who, when we look back through their history together, had signs appearing 5, 7, sometimes 10 years earlier. Signs that were dismissed by them, and sometimes by other doctors, as normal aging, stress, or something completely unrelated to their brain. I am making this video because the information I am about to share is not complicated. It does not require a brain scan. It does not require expensive testing. It requires you to know what to look for, and then to take what you find to your physician and ask the right questions. That is what today is for. Before I name the 8 signs, you need to understand what is actually happening inside the brain, because without this, these signs will not make complete sense to you. Think of your brain like a city with an elaborate waste removal system running underneath it. Every night, while you sleep, your brain's glymphatic system, a network of fluid-filled channels surrounding your blood vessels, flushes out toxic waste products that accumulated during the day. One of those waste products is a protein called beta-amyloid. This system was identified and described by Dr. Maiken Nedergaard and her team at the University of Rochester in research published in the journal Science in 2013. Their findings demonstrated that this clearance process operates at dramatically higher rates during sleep than during waking hours, making consistent, quality sleep one of the most biologically significant things you can do for your brain. In a healthy brain, this clearance system works efficiently. Amyloid is removed, the city stays clean. In Alzheimer's disease, that clearance system becomes compromised. Amyloid begins to accumulate into what researchers call plaques. A second protein, tau, begins to collapse the internal scaffolding of neurons, forming what are called tangles. As these plaques and tangles spread, they follow a specific, documented path through the brain, mapped by researchers Heinrich and Eva Braak across decades of work, now referred to as Braak staging. For Alzheimer's disease, That path begins in the transentorhinal and entorhinal cortex, regions central to memory and spatial navigation. From there, it spreads through the hippocampus, then outward through regions governing fine motor control and visual processing, and eventually reaches the broader memory centers themselves. Separately, research has established that the olfactory system, the brain's smell processing network, is also affected very early in the disease's progression. The connections between the entorhinal cortex and the olfactory system mean that smell loss is one of the earliest and most consistently documented warning signs we have. I will come back to this in detail. This is why the warning signs are not always in your memory first. They are in your hands. They are in your face. They are in your nose. The disease announces itself in places most people never think to look, years before it reaches the memory centers. That is what we are looking at today. Sign number 1, weakening grip strength. Most people assume a weaker handshake or a softer grip is simply a natural consequence of aging. The research tells a more specific story. A large-scale analysis drawing on data from the UK Biobank, one of the largest health databases in the world, involving over 466,000 participants, found that lower grip strength in midlife was independently associated with a significantly higher risk of dementia later in life. Specifically, individuals in the lowest quintile of grip strength had a 72% higher risk of developing dementia compared to those in the highest quintile. The findings were published in the Journal of Cachexia, Sarcopenia, and Muscle, and held after researchers controlled for physical activity, cardiovascular health, and socioeconomic variables. Here is why this is not just a muscle issue. Grip strength is a reliable marker of central nervous system function. The neural pathways that coordinate grip involve the same motor planning circuits in the brain that Alzheimer's pathology begins to compromise in its earliest stages. If your grip strength has declined noticeably over the past 2 to 3 years, not due to an injury, not due to arthritis alone, that is worth raising with your physician. But the second sign takes this further, and it is one that almost nobody pays attention to. Sign number 2, changes in handwriting. A 2023 systematic review published in the Journal of Alzheimer's Disease, analyzing 91 studies on handwriting in Alzheimer's, confirmed that handwriting is impaired at all levels of the motor cognitive hierarchy in the disease. The confirmed established findings include higher variability in signatures, longer time to complete written tasks, a higher ratio of time with pen in the air versus on the page, and reduced fluency of movement. These changes are measurable using digital writing tablets and have been replicated across multiple research groups. The broader handwriting literature also indicates that these kinematic changes can be detectable in patients with mild cognitive impairment before a diagnosis of Alzheimer's disease is made. Handwriting is a highly complex motor task. It requires coordinated input from multiple brain regions simultaneously: the motor cortex, the cerebellum, the prefrontal regions involved in planning. When those connections begin to deteriorate, handwriting changes, often subtly, often years before anything else is consciously noticed. Pay attention to growing irregularity in spacing between words and lines. Pay attention to writing that has become slower or less fluid than it once was. Tasks that used to feel automatic now taking noticeably longer. It is worth noting that unlike Parkinson's disease, where letters tend to shrink over time, the letter size changes in Alzheimer's are inconsistent across individuals. What matters most are the kinematic signals: the hesitation, the slowing, the loss of smooth, continuous movement. This is not about writing quickly or having a bad day. This is a persistent, progressive change that most people attribute to joint stiffness, and leave at that. The third sign is directly connected to this one. Sign number 3, difficulty with fine motor tasks. Buttoning a shirt, picking up small objects, tasks that once required no conscious thought at all. A growing body of research tracking fine motor function in older adults over time has found that declining dexterity in the hands predicts cognitive decline independent of other established risk factors. A longitudinal study following over 2,300 community-dwelling older adults found that difficulty completing simple manual dexterity tasks, including putting on a shirt, was associated with a significantly higher risk of developing cognitive impairment during follow-up. Fine motor decline has been shown in multiple cohort studies to occur in parallel with, and in some research to precede, measurable cognitive changes. The mechanism is the same as with grip strength and handwriting. Fine motor control is governed by neural circuits in the premotor cortex and cerebellum, circuits that Alzheimer's pathology gradually disrupts as it progresses through the brain. When patients tell me they have been dropping things more frequently, that they struggle with tasks that used to be automatic, I do not dismiss that. I investigate it. Now let us move from the hands to the face, and the next sign requires some nuance. Sign number 4. Poor peripheral circulation and persistently cold hands. Cold hands alone are not a sign of Alzheimer's. I want to be precise about that. But persistent poor peripheral circulation, particularly when it appears alongside other risk factors on this list, is a documented early indicator of vascular compromise that directly affects the brain. The 2020 Lancet Commission on Dementia Prevention, Intervention, and Care, one of the most comprehensive dementia research reviews ever published, authored by Professor Gil Livingston and colleagues, identified 12 modifiable risk factors for dementia, with midlife hypertension among the most significant. The circulatory system that supplies blood to the tips of your fingers is the same system that supplies your brain. When peripheral circulation becomes chronically impaired, the brain is frequently not far behind. We will come back to a patient whose persistently cold hands told me something her blood work never flagged. The 5th sign is the one most people find hardest to believe, and yet it is some of the most robustly supported research in this space. Sign number 5. Gum disease and chronic oral inflammation. Bleeding gums when you brush, gum recession, persistent inflammation in the mouth. In 2019, a landmark study published in the journal Science Advances, conducted by researchers at Cortexime Inc. and the University of Louisville School of Dentistry, led by Dr. Stephen Dominy and Dr. Jan Potempa, identified the presence of Porphyromonas gingivalis, the primary bacterium responsible for chronic gum disease, in the brain tissue of deceased Alzheimer's patients. Toxic proteins produced by this bacterium, called gingipains, were also found in the brain, and their levels correlated directly with the accumulation of tau tangles and amyloid pathology. The same research team found that infecting mice with this bacterium produced amyloid production in the brain consistent with Alzheimer's pathology. A separate large-scale epidemiological study, using Taiwan's National Health Insurance Research Database and following nearly 28,000 adults over a follow-up period of up to 16 years, found that patients with chronic periodontitis lasting 10 years had a 70.7% higher risk of developing Alzheimer's disease than those without. That research was published in Alzheimer's Research and Therapy. Bleeding gums are not a cosmetic concern. They are an inflammatory signal with documented biological pathways to the brain. The 6th sign moves us squarely to the face, specifically to your eyes. Sign number 6. Difficulty with vision and spatial judgment. If you have found yourself misjudging distances, reaching for a glass and missing it slightly, misjudging the height of a step, struggling to read despite a recent prescription update, This warrants attention beyond simply changing your glasses. A variant of Alzheimer's, called posterior cortical atrophy, documented extensively by Professor Sebastian Crutch and colleagues at University College London, primarily affects the visual processing regions of the brain rather than memory in its early stages. But even in typical Alzheimer's disease, the visual cortex is affected earlier than most people realize. Research published in Alzheimer's and Dementia has found that subtle difficulties in visual processing and spatial judgment can precede memory complaints by several years in patients who later receive an Alzheimer's diagnosis. If you or someone close to you has begun struggling with visual tasks that were never previously difficult, tasks that a new glasses prescription has not resolved, that is worth a specific conversation with your physician. Sign number 7. Loss of sense of smell. This is the sign I warned you about at the beginning of this video. The one that looks completely harmless. The one most people have had for years and attributed to seasonal allergies, a cold they remember having 2 winters ago, or simply getting older. Here is why this matters so much biologically. The olfactory system, the brain's smell processing network, is deeply connected to the entorhinal cortex, which is one of the very first regions affected by Alzheimer's pathology. These early disease changes in the entorhinal cortex disrupt the olfactory processing system at a very early stage, before most other symptoms emerge. The relationship between early Alzheimer's pathology and smell loss is one of the most consistently documented findings in the field. Research from the Rush Memory and Aging Project at Rush University Medical Center in Chicago, a longitudinal epidemiological study begun in 1997 that has followed hundreds of older adults annually, has consistently found, across multiple published studies, that lower scores on validated smell identification tests are associated with significantly higher subsequent risk of cognitive decline and Alzheimer's diagnosis. These findings have been published in peer-reviewed journals, including Neuroepidemiology and Alzheimer's and Dementia, using the brief smell identification test administered annually to participants over years of follow-up. The broader research literature confirms this relationship robustly. A study published in Neurology, following over 1,000 adults in a multi-ethnic New York community, found that olfactory deficits predicted future cognitive decline and Alzheimer's dementia, supporting the cross-cultural utility of smell testing as an early cognitive biomarker. A reduced ability to identify familiar smells. Difficulty distinguishing between scents that were once instantly recognizable. Food beginning to taste less distinct, because so much of what we experience as taste is, in fact, processed through smell. If someone you love has mentioned that food doesn't taste the way it used to, that they no longer smell things the way they once did, and if this has been happening gradually over months or years, please share this video with them, because this sign carries some of the most compelling biological evidence of any on this list as a meaningful early marker of what may be beginning in the brain. Sign number 8. Retinal changes visible on examination. The retina is not simply part of the eye. It is a direct extension of the central nervous system, the only part of the brain visible from outside the body without surgery. Researchers at Moorfields Eye Hospital in London, working in collaboration with the UCL Institute of Ophthalmology, published findings in the journal JAMA Neurology demonstrating that thinning of specific layers of the retina, detectable through a standard non-invasive examination called optical coherence tomography, was associated with cognitive decline in a community-based cohort of 32,038 participants from the UK Biobank. The research team described it as the largest study of its kind and the first to identify that future cognitive decline is associated with a thinner retinal nerve fiber layer in a large, healthy cohort. A separate study, published in JCI Insight by researchers at Cedars-Sinai Medical Center examining post-mortem retinal and brain tissue, found that amyloid deposits, the same plaques that accumulate in the Alzheimer's brain, are detectable in the retinas of Alzheimer's patients, and that retinal amyloid levels mirrored brain pathology, particularly in the primary visual cortex. It is important to note that this amyloid detection used specialized research imaging technology and is not yet a routine clinical procedure in standard eye clinics. What is available in most comprehensive eye clinics today is standard optical coherence tomography, the non-invasive scan used in the Moorfields study, which measures retinal nerve fiber layer thickness. This is the technology to ask about. You cannot see retinal changes yourself in a mirror, but your ophthalmologist can measure your retinal nerve fiber layer with equipment that is already standard in most comprehensive practices. If you are over 55 and you have not had a comprehensive eye examination in the past 12 months, an examination that goes beyond checking your prescription, I would encourage you to request one and specifically ask your provider about retinal nerve fiber layer measurement using optical coherence tomography in the context of cognitive health. I told you I would come back to Margaret. Margaret was 64 years old, a retired primary school teacher. She walked 30 minutes every morning without fail, watched her diet carefully, and had not missed an annual checkup in 15 years. Her blood pressure was normal. Her cholesterol was managed. Her GP had told her consistently that she was in excellent health for her age. She came to see me because her daughter had noticed something. Not memory lapses. Her hands were always cold, had been for 2 or 3 years. She had been dropping things more, and her daughter had gently pointed out that Margaret had stopped making the complex recipes she once loved, not because she didn't want to, but because she found the sequential steps harder to follow than she used to. When I conducted a full cognitive and sensory assessment, I found 3 of the 8 signs I have just described present in a meaningful way. Her performance on a validated smell identification test placed her in the bottom quartile for her age group. Her handwriting had measurably changed over a 12-month comparison, and her fine motor performance on standardized testing was below the expected range for a woman of her age and health profile. She did not receive an Alzheimer's diagnosis that day, but she left with something more immediately valuable: a plan. Targeted anti-inflammatory dietary changes, vascular risk optimization, sleep quality assessment and intervention, a referral for comprehensive retinal imaging, and a dental appointment she had been putting off for 2 years. 18 months later, her inflammatory markers had improved significantly. Her sleep quality, measured using a validated instrument, had increased. And she said something I hear from patients in this position more often than I would like. Why did nobody tell me this sooner? That is the gap. The research exists. The evidence is published in journals available to every physician. But the 15-minute appointment is not structured to deliver this conversation. That is what this video is for. If you have made it this far, you are clearly invested in this, and what comes next matters just as much as what you have already heard. Before we continue, I want to ask you something directly. Of the 8 signs I have described, grip strength changes, handwriting changes, fine motor difficulty, poor peripheral circulation, gum inflammation, visual and spatial changes, loss of smell, and retinal changes, do any of them apply to you? Even one? If yes, type the word "yes" in the comments right now. I read every single one. And that one word tells me something important about who is watching and what this community most needs next. If this video has already given you something useful, tap subscribe. It takes 1 second. Because what I am about to cover, 3 specific evidence-backed actions you can take starting this week, is the most actionable part of this conversation, and it is not something you want to miss. Let me make something explicit before I give you the practical steps. Every claim in this video is drawn from published, peer-reviewed research. The grip strength and dementia data from the UK Biobank, published in the Journal of Cachexia, Sarcopenia, and Muscle. The handwriting analysis, from a systematic review of 91 studies, published in the Journal of Alzheimer's Disease. The glymphatic clearance research, from Dr. Maiken Nedergaard's team at the University of Rochester, published in Science in 2013. The preclinical disease window, from longitudinal biomarker studies, published in Lancet Neurology. The olfactory findings, from the Rush Memory and Aging Project and a multi-ethnic New York cohort, published in Neurology. The gum disease and amyloid connection, from Science Advances in 2019, confirmed by nearly 28,000 patients in the Taiwan National Health Insurance Research Database, published in Alzheimer's Research and Therapy. The retinal nerve fiber layer findings, from Moorfields Eye Hospital and UCL, published in JAMA Neurology. The retinal amyloid findings, published in JCI Insight by researchers at Cedars-Sinai Medical Center. The cardiovascular and dementia risk framework, from the 2020 Lancet Commission on Dementia Prevention, Intervention, and Care. I am not asking you to take any of this on faith. I am asking you to take it to your physician and ask specific questions. Bring this list. Ask about smell identification testing. Ask about retinal imaging. Ask about your gum health in the context of cognitive risk. Ask about grip strength assessment. These are the questions that the standard appointment does not create space for. You have to be the one to ask them. Here is what the research actually supports as actionable right now, this week, at no cost. 1. Protect your sleep. The glymphatic system, your brain's mechanism for clearing amyloid and other waste products, operates at dramatically higher rates during sleep, as established by Dr. Maiken Nedergaard's team at the University of Rochester in research published in Science. When consistent, quality sleep is chronically compromised, amyloid clearance is reduced, and accumulation accelerates over time. 7 to 8 hours of quality sleep, consistently, is not optional for brain health. It is the most accessible and most evidence-supported intervention the research points to for cognitive longevity. 2. Treat your gums seriously. Chronic periodontal disease is a modifiable risk factor for dementia with a documented biological mechanism, a specific bacterium that crosses into brain tissue and directly promotes amyloid production, as confirmed in Science Advances in 2019. The Taiwan epidemiological data, nearly 28,000 participants followed for up to 16 years, quantified the associated risk at 70.7% higher for those with 10 years of untreated chronic periodontitis. Twice daily brushing, daily flossing, and a dental checkup every 6 months. Applied consistently, this directly addresses one of the most evidence-backed oral-to-brain inflammatory pathways we now understand. 3. Request a smell identification test. The University of Pennsylvania Smell Identification Test is a validated, clinically used instrument that assesses your ability to identify familiar odors. It is non-invasive, takes under 15 minutes, and is supported by a growing body of evidence as an early cognitive screening tool. Meta-analytic data from 25 studies and over 13,000 participants has confirmed an overall sensitivity of 0.79 and specificity of 0.78 for distinguishing cognitively normal individuals from those with Alzheimer's disease. It is not yet routine in most checkups. Ask your physician for it by name. None of this is complicated. None of it is expensive. All of it is grounded in research you can look up yourself. Applied consistently, these 3 changes directly address 3 of the most well-evidenced upstream mechanisms in Alzheimer's development: sleep-driven amyloid clearance, oral-to-brain inflammatory pathways, and early olfactory biomarker monitoring. They do not guarantee anything. No single intervention does, but they are where the evidence points. and they are available to you starting today. Before I close, I want to ask you one question. Of the 8 signs I described today, which one surprised you most? Which one did you never expect to connect to brain health? Tell me in the comments right now, because the answer almost always tells me where the largest gap in public health understanding actually sits. And your answer shapes what I cover next. Your comment matters more than you know. Share this video, not for this channel, for the person in your life who has mentioned that food doesn't taste the way it used to, for the person whose handwriting you have noticed changing, for the person whose hands are always cold and who has never once thought to connect that to what may be beginning in their brain. That share may reach them before the morning it matters. If this video gave you something real today, subscribe. New research on brain health, cognitive protection, and the conversations the medical system doesn't routinely make time for. That is what this channel is built around. I am Dr. Monty Fisher, and I will see you in the next one. Everything shared in this video is general educational information based on published, peer-reviewed research. It is not a substitute for personal medical advice. If you are currently managing any neurological condition, cardiovascular condition, or have concerns about cognitive decline, please speak with your physician before making changes to your health routine. This information is a starting point for that conversation, not a replacement for it.